Watch this.
It's the crisis situation we have hoped to avoid since the beginning of this public health crisis. 10 Idaho hospitals are now operating under crisis standards of care. Crisis standards of care. For the first time in Idaho history, healthcare is being rationed based on a dire need because of a lack of resources. A severe shortage of staffing and available beds in the northern area of the state, according to the Department of Health and Welfare. Resources that have been consumed by caring for a massive increase of coronavirus patients. We came this close to this scenario last December, and we knew for the last couple of weeks we were teetering toward it again. Well, this morning it was announced we had fallen from that fulcrum. Not that hospitals hadn't done all they could to not be in this situation. Back on August 23rd and 24th, Kootenai Health installed a bigger oxygen tank there because the one they were using wasn't enough. And they converted the hospital's largest classroom into a place to put COVID patients, an overflow COVID unit for 22 patients not needing intensive care. That week, Kootenai Health said within a 36-hour period, 4 of their COVID patients died. Three of those 4 were under the age of 45. On Friday, Kootenai Health had 93 COVID-19 patients in the hospital. This morning, it was 108. 39 of which are in the ICU. Their website states 97% of their COVID patients are unvaccinated. So what does this crisis standards of care look like? We've laid this out before, but with today's news, it's worth another explanation. I've said this before as well, but for those of us of a certain age, we learned the term triage through the TV show MASH. Remember when Doctors Pierce and McIntyre or Major Houlihan would just walk onto a bus or through the stretchers that were lined up outside the surgical tent, and they would say, take that one, or he can wait, or he's not going to make it. And that's how they decided who got brought into the tent to get immediate medical attention. Idaho's crisis standards of care are kind of laid out the same way. First to get help would be those with immediate need, the red category, those with a life-threatening illness or injury where there's a chance their life can be saved, but something needs to be done quickly. Yellow, or delayed need, those who would be treated second, would have serious but not life-threatening issues, and waiting won't matter much to survival. Then there's minimal need, which is kind of self-explanatory. Minor injury or illness, you can walk in on your own kind of thing, but you would just have to sit there in pain while you wait for the third priority. The fourth category, and one which would have been higher in different circumstances, the expectant, or code black. That means you're in a bad way and not expected to survive what ails you, meaning they could try, but it would take too many resources and likely wouldn't have the desired outcome. In crisis standards, those folks are pushed to last, whereas in conventional care, that try would come much sooner. The State Department of Health and Welfare planned out these priorities last year when we were this close but never got there. But this is what is happening right now in North Idaho. In other words, if you break a wrist, the bones that are in your wrist, and you need surgery to fix it so it doesn't heal improperly, well, that's going to be tough. And while it may not be under the urgency of or the backdrop of war, like in MASH, nor is it because of a tragic natural disaster, this is still the state of care in 10 of Idaho's hospitals. Governor Little used this news today as a chance to address vaccinations once again. We have reached an unprecedented and unwanted point in the history of our state, he said. We've taken so many steps to avoid getting here, but yet again, we need to ask more Idahoans to choose to receive the COVID-19 vaccine. Right now, only 49% of eligible Idahoans have been fully vaccinated. And before you think, well, that's just up north, we're fine everywhere else, let's take a look at what it looks like statewide. The last week of August, the day the governor toured an ICU and saw all the COVID patients fighting for their lives, and he called it heartbreaking, the state website showed there were 72 ICU beds available. It dropped to 31 the next day. We bounced back towards 60 for a couple of days, but since September 2nd, in just 4 days, we have dropped to 11 available beds. 11 available beds in Idaho's intensive care units across the entire state. That's a drastic drop and a pretty low number, not as low as 4, which is the number Governor Little pointed to last week, while the state's website showed that 72. But because of that discrepancy, which a lot of you pointed out, The state changed the way it charted available beds. Instead of just open beds or including open pediatric ICU beds, since September 3rd, they are tracking just beds that are available and able to be staffed. But the focus is on the Panhandle right now, where for the first time in Idaho history, care standards are in crisis mode. A declaration that covers 2 health districts, the Panhandle and North Central. And there are lots of questions as to how, why now, what's next, that Joe Paris will hopefully be able to answer for us. Joe, and I know major question right now is about the rest of the state, other regions other than North Idaho. How close to crisis are they?
Well, the short answer is that they're very close, but they're not in crisis standards of care outside of North Idaho right now. It's very important to note that this is just one section of the state, and that the Department of Health and Welfare and the medical communities, they're really able to do this tailored by region, and that's why we're seeing this. Now, activating crisis standards of care in other parts of the state, like the Treasure Valley, that was on the table in recent days when the State of Idaho Disaster Medical Advisory Committee met. Now, Health and Welfare Director Dave Jepson gave some insight a short time ago about the conversation he and the committee had about activating the crisis standards of care.
That it was appropriate for the North Idaho area, and it's a pretty serious thing to declare crisis standards of care. It's something that none of us do lightly and take very seriously. And at the end of the day, we felt like we had just a little bit of wiggle room left in the rest of the state, but I want to emphasize not much.
So it's a bad situation right now, and the question, Brian, is how long do these crisis standards last? And long story short, this is not a 1-day or a 2-day thing. It's possible that we could jump in and out of it, but it's not likely. As Director Jepson highlighted this afternoon, this is really a major deal to trigger crisis standards of care. This is not a formality. This is not something that just happens once in a while. This is the last resort. This is pulling out all the stops for the medical system. It's a big deal. And Jepson and Dr. Robert Scoggins, who's the Chief of Staff of Kootenai Health up in North Idaho, they gave insight about navigating the crisis standards of care and really what the future could look like over the next few days and weeks in North Idaho, and in terms of where do we go from here and how does the crisis standards of care operate in terms of when are we going to be under them? Are we going to be out of them soon?
Yeah, could it go back and forth?
Could it go back and forth? Here's the insight they have on that question.
We will make that decision as it's warranted. And so if we get into a situation where it's clear we can go back to the usual standard of care, even if it's stressed, but we can go back to the usual standard of care, we'll do that. And then if the situation changes again, we would then relook at crisis standards of care. So we are going to watch the situation daily, monitor daily, and then make decisions as they're appropriate for the situation on the ground.
If it were to go away tomorrow, we would be out of crisis standards pretty quick, but I don't see that happening either.
Long story short, Brian, at least in North Idaho for now, we know it's going to be crisis standards of care for at least a short term, likely longer than that, depending on how many people are getting sick and having to get ICU care up north. Dr. Scoggins talked earlier that the percent positivity up in the community in North Idaho, it's very high. So they're expecting an influx of patients in the coming weeks.
So Dr. Scoggins with Kootenai Health right now, what is he seeing in his hospital?
Yeah, he's seeing some very terrible situations. They're seeing a situation where they're having to move into other areas just to give care to patients. They're moving into conference rooms, as we highlighted. They're now actually having patients in those conference rooms. At last check, they had 19 people on ventilators. When you hear that someone's on a ventilator, Brian, it's not like, okay, we'll try a ventilator. That's a last resort.
Right.
I'm sure a lot of our viewers and you have seen the situation that's created with the ventilator. They are forcing air down your throat in a very violent way, and that's because it has to be that way. There's also concern right now, Brian, about younger patients getting very sick with COVID, and that, along with everything else, is taking a major toll on frontline healthcare workers.
Those younger patients really do affect the staff quite a bit, and it's very traumatic to see young people that have many years of life left in them pass away. So, but the problem this time around is that it seems to be getting younger, and there is concerns as schools open here that we're going to see even younger patients.
And Brian, as we know, down here in the Treasure Valley in recent weeks, there's been major focus on schools and masks and COVID protocols. And I just think it's worth pointing out that on the health and welfare call today, you had several state healthcare leaders pointing to the fact that West Ada School District, who's the largest school district in the state of Idaho, they're recommending that Well, they are requiring masks, but you can opt out. And there's, as we reported, there's a lot of parents that have opted out their kids from the mask policy in West Ada. And it was highlighted again by several health experts from the state that these masks do work, these COVID protocols do work. Are they perfect? No. But they said that they're expecting to see more aggressive protocols in the coming days. They noted that West Ada had started the year where staff could opt out of the mask policy. Now, as we reported yesterday, you have to wear that mask. As a staff member, parents still have the option for now to opt out their kids of wearing a mask in the West Ada School District. But as we heard from the experts this afternoon, they would suggest having masks for all students to really cut down on the amount of virus that is transmitting.
The other thing they're asking people to do or not do anything crazy that would put them in the hospital. I mean, that might be an easier ask than wearing masks, but they're still asking people. This is the state that we're in right now, is that we're asking people to, let's just take it easy for a bit so you don't get hurt.
Yeah, obviously you can't control for the most part if you're going to be in a car accident. That's
Sure.
something that you're not planning to do, but they're asking people to be careful with extreme sports, with decision-making skills, with hikes, because right now, at any given moment, the ICU in our area or several other regions in our state could be overwhelmed. And if there's major car accidents, if there's a group of hikers that get gravely injured, that impacts the ICU. And they made it a point, health experts in the state made it a point today several times, be careful. We do not want to overwhelm the health system. And a large part of that, Brian, they're asking people, and I know we've said this 100 times, if you can get the vaccine, health experts say they're safe and effective, and they're our best tool to cut down against the spread of COVID.
Another thing that we both thought was interesting with this crisis standards of care, what it does is limit the liability of the hospitals, because that who gets served and how often or when people can get sued. Doctors can get sued if you're not giving enough attention to somebody, but if you can't do it because of the resources, well, that's what this crisis standards of care does. That makes it kind of about the money, which is going to start a whole other conversation. I understand that. Another conversation that's been happening right now is it's a staffing shortage issue. And as people are posting and asking us about this, has it anything to do with the vaccine requirements from our major health providers? Even Representative Brent Crane posting this. This is a direct result of primary health requiring their staff. He put this on Facebook, by the way, requiring their staff to take the COVID vaccine. Expect more news like this from St. Luke's and St. Al's. This is about Idaho's access to care and the staff not there to handle that. Well, I asked Representative Crane where his information came from, and he hasn't responded. Didn't get back to me, other than just throwing something out there. But I called Dr. David Peterman with Primary Health to confirm this on a holy day for him, by the way. And he said, this isn't the case at all. In fact, it's shameful, he said, that people are using this vaccine requirement as a way to say, well, this is why we're having problems in our hospital. 91% of the 640 employees of Primary Health, Dr. Peterman told me, 91% of them are vaccinated, with about 8.5% that have gotten an exemption because of religious issues. 91%. And yes, he again also said vaccines and masks. So it's not about the vaccines, unless, of course, that's going to keep people out of the hospital.
Yeah. Again, they're encouraging everyone that can get the vaccine to go do it right away. We're in a crucial point here in the Treasure Valley, Brian. We need to take action now.
Thank you very much, Joe. All right, so Ada County Commissioner Ryan Davidson made it clear when he made his choice to fill the physician position on the Central District Health Board. Davidson said he wanted an outsider. Well, the outsider is now on the inside. Dr. Ryan Cole is now officially on the CDH board, the health district ratifying this appointment this afternoon after receiving all 7 votes from the counties under their jurisdiction. He needed 7 and got exactly that when Elmore County voted last week, 1 in favor, 2 opposed. The appointment fulfills the Idaho requirement for 1 physician to serve on each local board of health, a position with CDH that was previously held by Dr. Ted Epperly, whose contract was not renewed earlier this year. CDH oversees Ada, Valley, Elmore, and Boise counties. Dr. Cole's selection has been controversial from the start because of his reference to the vaccine as, quote, needle rape, and saying he, as a pathologist, prescribes ivermectin to patients to fight COVID, a treatment not recommended by either the CDC or the FDA. Dr. Cole's term is slated for the next 5 years until 2026. Reevaluating plans. A lot of people might be doing that right now due to this COVID surge, including some local schools. You know what you don't need to reevaluate? Your plans to jump in on the 208 conversation. Just go ahead. Send us your thoughts on the show or even your story ideas. The number is 208-321-5614. Just be sure to include your name and the hashtag #the208.
Do you feel like the bad guy in
All right, school still in session across, well, pretty much everywhere in the state, other than a few schools. We are seeing some districts, though, that are coping with COVID outbreaks and absences in different ways, quite different ways. Nampa School Board is going to meet tonight and tomorrow night to go over any potential revisions to their policies, or lack thereof, that they have put in place. Katya Stepovic has a breakdown of the COVID updates that will be presented to the board tonight. Katya?
Well, Brian, recent COVID data put together by the Nampa School District is raising eyebrows. Take a look. Now, as of last week, 14.5% of elementary students were not in attendance. It jumped to 20% for middle schools and more than 25% of high schoolers in Nampa. The district goes on to say that, quote, if we were using our benchmarks from last year, all high schools would be in the red and virtual. Middle schools would be in the orange and on alert, and elementary schools would be in the yellow category, with the exception of 4 elementary schools. Now, on August 30th, 2,692 students were not in school. Last year, the district only quarantined 2,579 students total.
When we say we have 22,000 some students out, we're not saying that they all have positive cases of COVID, but we're saying that COVID plays a big part in those numbers in one way or another. And once you get a certain percentage of your teachers out, there's just no way to cover that because we're short on substitutes.
At least 20% of elementary staff are currently out sick. On August 31st, 23 classrooms were unable to be filled. Now, the board will have a work session that will start at 6:30 tonight, so in a little over an hour from now, and parents are not allowed to be there in person, but they can send in written comments. And by the way, Brian, they aren't the only school with a meeting tonight. Mountain Home School District will also meet about their COVID policies, and links to those meetings can be found on the district's website, of course. Brian?
So kind of like with the healthcare workers, you can't just have a bed without somebody to serve it or to care for the person in it. Classrooms need teachers to be there as well.
Absolutely, and mind you, the substitute teachers, come down and contract COVID as well, so it's a vicious cycle. It
is spreading quite rapidly. All right, thank you very much, Katya. Well, the city of Sun Valley is considering not only bringing back their mask mandate, but they're also looking into requiring proof of vaccination. Last year, a mask mandate was in place inside and outside when around groups of people, large groups of people. Well, that was revoked in May, but as we know, things are much different now. Sun Valley's Mayor Peter Hendricks sent out this statement following a city council meeting last Thursday. Sent it to us and said, under direction from the city council, I met with the city administrator and the city attorney to discuss reinstating the emergency powers ordinance as well as a public health order mandating masks in the city of Sun Valley. City council also directed me to research and explore legislation to require vaccinations against the virus. Well, the legislation would have to come from the city council, but still, the research, they're looking into it. Mayor Hendricks has called a special city council meeting on September 14th to talk about possibly taking this action. Well, if it weren't for what happened this day in history, you might not be able to watch the 208, or at least not the way you do now. The invention of television isn't that clear cut. It happened on this day kind of thing. It wasn't just a one-time thing. It was a whole process with one person building on what the previous one did. The idea of transmitting pictures and sound dates back to, well, as far as Alexander Graham Bell. From there, it went to spinning discs, to cathode ray tubes, to what was invented on September 7th, 1927 by a 21-year-old Eastern Idaho farm boy, the electronic television. Before Farnsworth, it was more mechanical and more cumbersome. But thanks to the vision of Rigby's Philo Farnsworth, television planted its roots in society. The concept of television dates back to 1884, when a German scientist named Paul Nipkow invented a mechanical disc system. Reflected light would pass through the tiny holes in a spinning disc, turning an image into electricity. The second spinning disc would then decode the current, and a picture would appear. The mechanical scanning system proved impractical, but a modern electronic method was on the horizon in eastern Idaho. Lines in a field. Believe it or not, it was the inspiration for television. The year was 1921, and a young Philo T. Farnsworth was plowing this field on his family farm just 4 miles outside of Rigby. He was obsessed with the idea of television. He just couldn't figure out how to transmit a picture electronically. And then it hit him. Lines. Then a sophomore at Rigby High School, Farnsworth figured an image could be divided, then reassembled line by line using electrons.
And so by his own studies, he come up with this idea of making a picture through the air by electricity.
He diagrammed his idea on the chalkboard for his chemistry teacher, and the basic concept of modern television was born.
This is where it started here in Rigby. Rigby is the birthplace of television.
Farnsworth's invention involved a cathode ray tube, which acted as an image receiver. Inside was an electron gun. Using magnets to control the electron beam, lines were shot onto a phosphor-coated screen, recreating the image line by line at a rate of 4,500 lines per second. It wasn't until 1927 that Farnsworth first successfully demonstrated his all-electronic television system in San Francisco.
Well, the first image, the viewing for the public, was Pam, his wife.
Meanwhile, other scientists, like RCA's Vladimir Zworykin, were working on television experiments of their own. The development of an efficient camera tube ushered in a new era of broadcasting. And in 1939, the opening of the World's Fair in New York was televised. Later that year, RCA introduced its first commercial television set. It sold for $600, and the world began to buy into the new medium. All right, Bill texted in and wanted to know what hospitals in North Idaho are affected by this crisis standards. Benawa Community Hospital, Bonner, Boundary, Kootenai Health, Shoshone Medical Center, that's in the Panhandle District. Clearwater, Gritman, St. Joseph, St. Mary's, and Syringa hospitals are all included in that. That's 10 all told. Why are we not hearing about statistics regarding adverse effects, if any, with getting the virus? I'll tell you this. Kootenai Health on their website says none of their COVID patients in the hospital are there for adverse effects. Zero, none, and that pretty much extends over the entire health system. Not vaccinated, if you get sick, stay home and deal with it. Give our heroes a break. This one is, you're showing COVID every day. Too much, says Georgette. Georgette, we're in crisis standards of care right now.